That is the superior view of the right knee. You can see two menisci, that is the medial menisci, large one, and the lateral menisci, smaller one. The medial menisci is large and oval with two horns, an anterior horn and a posterior horn, while lateral menisci is smaller and circular with corresponding anterior horn and a posterior horn. Now the large medial menisci, like this you can see, is the small lateral menisci is contained inside the medial menisci. So this is the overall view of the menisci. So that means the horns of the menisci will be from anterior to posterior, can be seen as the anterior horn of the medial menisci, followed by the anterior horn of the lateral menisci, followed by the posterior horn of the lateral menisci, followed by the posterior horn of the medial menisci. So this is the arrangement of the horns of the menisci. Now, as we know, there are two cruciate ligaments, an anterior cruciate ligament and a posterior cruciate ligament. By default, the cruciate ligaments, both the cruciate ligaments are arranged posterior to the horns of the medial menisci. You can see the anterior cruciate ligament is arranged or anchored posterior to the anterior horn of the medial menisci, and posterior cruciate ligament is anchored posterior to the posterior horn of the medial menisci. So the name, the how you name the cruciate ligament as anterior or posterior is based on which horn of the medial menisci it is related to. That means the posterior cruciate ligament is related to the, is just behind the posterior horn of the medial menisci, while the anterior cruciate ligament is just posterior to the anterior horn of the medial menisci. So when you list the structures from anterior to posterior, first comes the anterior horn of the medial meniscus, followed by anterior cruciate ligament, followed by anterior horn of the lateral menisci, followed by the posterior horn of the lateral menisci, medial horn, the posterior horn of the medial menisci, and finally the posterior cruciate ligament. So you don't need to understand, you don't need to learn any mnemonics to understand this. First, focus whenever you see a diagram or you want to draw the diagram like this, always try to draw a diagram of a large medial menisci which is oval in shape, whose horn comes backwards and forwards. Why medial menisci is larger? We can logically understand. The medial menisci is large because the medial condyle of the tibia is large. Why the medial condyle of the tibia is large is because tibia is a medial bone which is larger and contains the weight of the, or supports the weight of the whole knee joint. So that's very easy to understand why the medial menisci is a key or the reference landmark here. So that is the medial menisci. Now, once you have drawn the medial menisci, now draw the lateral menisci as a small circle which is contained inside the opening or the unattached part of the medial menisci. So that is this. So 1, 2, 3, 4, 4 structures are ready. After that, you can think about the cruciate ligament. First, the anterior cruciate and the posterior cruciate. So anterior cruciate ligament is related with the anterior horn of the medial menisci, and posterior cruciate is related with the posterior horn of the medial menisci. And the term all the cruciate ligaments are located behind the horns of the corresponding horns of the medial menisci. So that is a statement. Cruciate ligaments are anchored posterior to the corresponding horns of the medial meniscus. Thank you.